Hey guys, it's your girl Kayla Monique, aka the Unshatterd Adoptee, and I'm back today with another video. But for today, I want to tap into a topic because it is Mental Health Awareness Month. So I want to tap into a topic that's related to adoption, foster care, and youth pregnancy. And today's topic is going to be PAD. And I know you guys are probably wondering what the heck is PAD. So PAD stands for post adoption depression. And I do have my journal here just with my notes, just so that way I can stay on topic for you guys today. So again, like I said, the topic today is PAD, which stands for post adoption depression. And it is similar to postpartum depression in the fact that it does involve a child, but it does differ in the fact that the adoptive parent is not experiencing any physical or any hormonal changes within their body since they actually didn't carry the baby. Now, some other things I want you to know about post adoption depression is the fact that symptoms can start to show up about a month after a child is adopted, and it can be relevant in either men or women. So it could be the adoptive mother or the adoptive father. And when it comes to the symptoms, since it is depression, it has similar symptoms to regular depression. So you're going to notice that you may have more moments or moods of being sad. You may lose interest in doing certain activities that you normally found that you love to do quite often. And then you're also going to notice some changes within your sleeping and your appetite pattern. So either you're sleeping too much, not sleeping at all, and same thing with your appetite. You may notice a loss of appetite, which I normally experience with depression, or you may experience an increased appetite. So it pretty much just depends on the person, but those are some symptoms that you're going to look for if you are an adoptive parent experiencing PAD. Now, one thing I do want you guys to know are some facts when it comes to PAD as well. So PAD can be experienced by 10 to 32% of adoptive parents. Again, it can show up in between 10 to 32% of adoptive parents. And again, this can be for both adoptive mothers and fathers. And something else that I want to flow into is going to be the solutions for PAD. If you are an adoptive parent and you are noticing that you are having these symptoms, even if it's longer than a month after you adopted a child, because even as an adoptee, I didn't even know anything about this. So I'm sure there are adoptive parents who don't know about it either. So some of the solutions that you can try to help with PAD are the first two I'm going to mention are pretty common again for somebody else who may be experiencing depression. So it's going to be support groups, but specialized support groups around PAD. And I'm sure you can probably find these different support groups within your community by simply Googling it. You could probably use Chat GPT or possibly maybe reaching out to your medical provider. The next solution is going to be, of course, getting therapy, seeking professional help. Like I said, speaking with your medical provider and they see if they can refer you to a therapist that specializes in that particular depression. And the last two I want to touch on are the top two that really stood out to me in this particular depression when it comes to adoptive parents. And the first one is going to be addressing your expectations. And expectations can affect anybody. You know, just being a parent in general, we have our own expectations. But specifically when it comes to adoptive parents, when I say address your expectations, when I think of that, I'm thinking about what you're expecting the outcome to be once you adopt this child. And I'm sure for a lot of adoptive parents, it's that things are going to go smoothly, you know, because a lot of times you just hear a child just needs love, you know, and even if you're giving love to a child, there are still underlying causes. They may have trauma that they're dealing with that may come out that you didn't expect. There may be some mental health issues that you weren't aware of because maybe the medical history of the birth parents is slim. So when I say addressing your expectations, just being open to the fact that it may not be a walk in the park, just like any experience in our life, and just be ready to be prepared for those possible pitfalls or those obstacles that you may face with bringing a new child into your home, because it's a big deal, you know. And I was two when I was adopted, so I don't quite remember, but I can only imagine what it can be like for someone who's a teenager or older, who's able to really understand what's going on, and you know what I mean, has all these emotions bottled up that they don't know how to express. And when we don't know how to express something, just like a baby crying when they're thirsty, crying when they need a diaper, it's the same thing for us, and it's the same thing for youth. If we don't know how to express that emotion, it usually comes out with us having some type of temper tantrum in some way, shape, or form. So again, that's one of my top solutions that I came across that I would pass along to someone who is already an adoptive parent and experiencing PAD. The second top solution and the final solution I have for you guys today is going to be seeing if the depression that you're experiencing is attached to infertility or possibly past miscarriages. Because oftentimes we don't know what may trigger a certain emotion that we may have. And I can definitely imagine this as someone who's been, not personally, but if you're someone who's trying to have a child and unfortunately that's not going to be the outcome and you have to go through foster care or adoption, I can definitely imagine someone being triggered by bringing another child in the home and having feelings of, wow, like, man, I wish that, why couldn't I have a child and actually have that biological connection? Or even if you're having issues with this new adopted child, man, maybe if, you know, this child was mine, or if I didn't have that miscarriage, or, you know what I mean, maybe the situation between me and this child would be better. Maybe the bond would be stronger. So that's something that really stuck out to me. And I'm pretty sure that there are some parents out there, adoptive parents again specifically, who are experiencing this and probably never talked about it. You know what I mean? Never felt safe enough to talk about it, or simply just thought that there was nobody else that would identify with their story. So I hope that me sharing this video today and really diving deeper into those two solutions is something that can help somebody today. If you want to reach out to me via DM, or if you're comfortable enough with leaving a comment below, I would definitely appreciate that. But I want people to feel comfortable and I want them to feel safe. So again, if it's something that you don't feel comfortable having everybody knowing your business, just simply send me a DM so we can try and talk about it. Or maybe I can support you on finding the help that you may need to get through PAD. So that's it for this video today. Again, this video is in highlighting Mental Health Awareness Month and just how it can affect people affected by adoption, foster care, and youth pregnancy. And I hope you enjoyed this video today. Please like, comment, and share. Share, share, share. If there's someone that you know will definitely resonate with this video or it may be benefiting to them, please go ahead and share it with them. And I will see you guys in the next video.